Hello, everyone, and welcome to Bellworks. Good afternoon. If you're eating lunch, you can stay and enjoy. Today we have a special lunch and learn here with our friends from NuGen Medical, located in Bell Wellness on the block. My name is Brooke Petrani. I am the head of marketing at NPZ Studio Plus. We are the marketing and design firm behind Bellworks, the creative team here. Thank you for joining us for today's Lunch and Learn. It's called The Missing Link. Today we are featuring Dr. Danielle Biggs, Dr. Corinne Espinosa, and Dr. Dhaval Patel. So please enjoy your lunch. We have some complimentary coffee and tea over to the right over here. But sit back and enjoy the panel. I'll hand it over to you three. Thank you.
Hey guys, if you're interested in looking and performing like the people on TV right now playing soccer, you may want to listen in because we can help you with that. Anyway, I'm Dr. Danielle Biggs. I'm one of the physicians at NuGen. We are a longevity medicine practice. So what does that mean? We help you not feel and perform and optimize yourself today, but the next 5 to 10 years to come. So we're different in terms of traditional medicine in that we optimize your hormones. We look at your metabolic profile and say, hey, this is me, how you look now. Maybe your blood work looks good now, but what kind of markers do you have that show what might be down the road for you in 5 to 10 years? And we optimize your health with hormones, peptide therapies, things like NAD. We do weight loss management. We give supplements. We give suggestions for vitamins and supplements. We have a 3D body composition scanner because when it comes to kind of losing weight and getting in shape, it's not just about the number on the scale, but about your body composition. Where are you building muscle? Where are you holding that fat that puts you at higher risk for cardiovascular disease, insulin resistance, and we help optimize these things. So I am an emergency medicine physician. We started NuGen about a year ago now, and now we spend a lot of our time optimizing people's health.
I'm just going to do a brief intro because I thought that was a great lead-in. I'm Dr. Corinne Espinosa. I'm also an ER physician, and then I'll pass it over.
Thanks. Dhaval Patel. I'm actually one of the physician assistants that co-founded NuGen with Corinne and Danielle. But as Danielle was saying, we are longevity focused. For so many years, collectively over 3 decades, we've kind of become accustomed to reactive medicine. And now we're on the other side, proactive medicine, right? That's what longevity is about. Our goal is to kind of increase your health span, not just your lifespan. And that means do the things that you love to do today well into your 80s, 90s, or even 100. And we have the tools and resources to do it, so why not utilize it?
All right, so I want to get started with some staggering statistics. So we're talking about hormones and mental health today. Hormones are having a day right now, probably all over your social media, whether it be estrogen, progesterone, testosterone. And so we want to talk about how those hormones play into your mental health. Many people may go to their physician saying, you know, I'm feeling more depressed, I'm having trouble sleeping, and they're automatically getting put on antidepressants and giving sleep medications, where a lot of this may just be originating from hormones. So just some statistics to think about. 70% of people with depression may actually have an underlying hormonal imbalance contributing to their symptoms. Women are 2 to 4 times more likely to develop depression during perimenopause. Up to 80% of women experience sleep disruption during perimenopause. Suicide rates are the highest among women ages 45 to 64. Men account for nearly 80% of all suicide deaths. Men with low testosterone are 2 times more likely to experience depressive symptoms compared to men with normal testosterone levels. 1 in 4 men will experience a mental health disorder during their lifetime, yet less than half of them seek treatment. And divorce rates are highest among adults ages 40 to 60.
So I'm going to talk a little bit about traditional medicine and how we kind of differ. So any of us can go in, we're going to see a regular doctor for a regular workup, and we're going to tell them, we have these certain symptoms, whether they be fatigue, anxiety, problems with brain fog or memory, decreased motivation, I'm having difficulty in my relationships. And as Dr. Biggs just said, a lot of times most patients will walk out and they'll have this feeling that they weren't listening. The doctors weren't listening. They wrote a prescription for a medication for depression, a medication for anxiety, something to help them sleep. And this is very common. We have a lot of patients that come in with a whole new laundry list of medications, and they've never had a history of depression. They've never had a history of anxiety. They've never had sleep, but somehow everyone is developing these symptoms during this time period. So, something that we stress, which is something that we never learned in medical school. In medical school, you always talk about symptoms, and you try to give a medication based off of this symptom and another one for this symptom and another one for this symptom, where we're not actually looking at what the overall cause might be. And we have found, and research has shown time and time again, and social media has kind of helped push this, is that hormones might be that bottom line, this foundation that's actually causing patients to develop all of these symptoms all at one time. And unfortunately, in the past, most patients weren't able to express this and feel comfortable in divulging these symptoms to either their family or their friends or the doctor that was supposed to be looking after them, right? Even, in my current age bracket, right? It's very difficult for young women or young men to say, I'm having these symptoms. I don't know who to talk to. And this is something that we've really have come to focus on. So in terms of, just hormones in general, right? Hormones are so much more than just, we use them for reproduction, right? It's just to have babies and move on. Major chemical messengers in the body that control a lot of who we are as individuals. It helps us kind of determine our memory, our cognitive function, our libido, our body composition, our metabolic health, our heart health, and all of these things can have a drastic change if we're having these changes in our hormones. So when hormones start to change, men and women will start to feel as though they don't know who they are. We have this common statement that we say to some of our patients where you look in the mirror and you don't recognize the person that's staring back at you. So in terms of women, because I'll focus a little bit more on women, is most women at the mid half of the 30s into 40s will start developing symptoms of what we call perimenopause. And perimenopause was never a thing. If the majority of you ask your mothers, they will have no idea what you're talking about. But perimenopause is trending. Anybody on social media who has kind of hit this algorithm will know what perimenopause actually is. And it's these symptoms that we talked about. So brain fog, anxiety, decreased motivation, difficulty with sleep, difficulty with libido, weight gain. These are all symptoms of perimenopause until we get to this period of menopause. And menopause, most people know what that is, but realistically, it's one day in time. It's the day that a woman can say, I haven't had my period in 365 days, and that's it. It's over. That's menopause, right? So, obviously this is also a time that women can feel very overwhelmed with how their body is responding to their hormones. So when we talk about women, the major hormones that we typically talk about are estrogen, progesterone, and testosterone. And testosterone is often missed in women, but it is a very important hormone for them. So the interesting thing is that estrogen actually influences a lot of these neurotransmitters in the brain. So your serotonin, your norepinephrine, your dopamine, and all of them, when they're having these changes, can be perceived as having problems with depression, your mood, how motivated you actually are. So when we have patients that come in, it's really important that we kind of analyze the symptoms as well as getting some lab work to see where they actually are.
And just to kind of chime in on that, working in the emergency department, we have women and men, in this, I would say 40 to 60 range, and they come in with these very vague complaints like, I just don't feel well. Something is just not right. And all my labs are always normal. And I know what you're going to tell me. You're going to tell me that everything looks great, but I don't feel great. And it's frustrating for us too, because we're like, what we can offer to these people from an emergency room standpoint is so limited. But now having NuGen and doing all this education on hormones and what else is going on with our patients, I can easily say to them now, This is hormonal. This can be fixed. You don't have to keep going to emergency departments. You don't have to just keep getting blood work that looks normal. Like, this is something that you can work with someone and you can feel good again. And I think that's been one of the most rewarding parts of being a part of NuGen, is being able to have these conversations that Corinne is talking about and be able to say, like, we can fix this. You don't have to feel this way. This is not what you're going to feel like for the next 10, 20, 30, 40 years. You can like your husband again. And we can work with you to do all these things.
All right, so on the men's side, it's a little bit simpler. There's only one hormone that I get to manage, but as Corinne and Danielle do a lot of women's health, I've kind of taken an initiative to the men's health side, and it's been very special as well over the past year, helping men. Testosterone plays a key role in many things in the body: mental health, cardiovascular health, even obesity. It's not just a sexual hormone. Usually the stigma around testosterone is it's for guys in the gym, it's for libido, it's for sex drive, it's for that, it's for this. But as Danielle alluded to in the introduction of this talk, low T can present itself as mental illness, depression, anxiety, lack of confidence, lack of motivation, not wanting to get out of bed in the morning. So presenting to a traditional doctor's office or anywhere, that could get misdiagnosed very easily, very quickly. And I don't blame them. I can understand why, because those symptoms overlap with thousands of other diseases. And, I've kind of taken initiative to safely dose testosterone, safely administer it, and safely monitor it. When done correctly, it is very safe. When used inappropriately, it can be harmful, because there's a stigma around that as well. But testosterone can present itself, low testosterone can present itself in various ways as well. Fatigue, again, low motivation, brain fog, reduced confidence, and increased body fat. And there's multiple causes of low T besides just physiological and besides aging, especially in our part of the world. It's diet related, food related, alcohol, smoking, obesity, lifestyle has a lot to do with it, including even vitamin deficiencies like zinc, vitamin D can lead to low T as well. So at NuGen, my goal is to kind of optimize you as a whole, look at you as a whole, and treat all of them. Because if we're going to put you on T, we want to make sure we optimize all those other factors to get the most out of the T that you're injecting. Otherwise, it's kind of worthwhile, right? You're just going to keep chasing yourself in an endless circle if there's other things that aren't optimized. And it plays a key role in, again, mental health, because this is the missing link between hormones and mental health.
Testosterone, like kind of Corinne touched on, is also important for women. I feel like that gets lost a lot in conversation. But testosterone is important for your metabolism. It's important for your mood. It's important for your libido. People may very oftentimes say, I'm doing all the right things. I'm going to the gym. I'm exercising. I'm eating right. Why can I not lose weight? And a lot of times it's very much hormonal. Another thing I kind of want to talk about with optimal. We want to keep you in the optimal range for testosterone, whether you're a man or you're a woman. When it comes to optimizing testosterone for women, there's a very tight range we want to keep you in. We look at your total testosterone that's in your body, but then we most importantly look at your free testosterone. And that is a testosterone that's actually able to do things in your body. So you may have a normal total testosterone, but your free testosterone, the one that actually makes a difference for you, can actually be low. And so we always look at both of them. And whether we're optimizing men or women with testosterone, that is something that we want to know the number you start at. We monitor at first 6 weeks and every 3 months, because we want to keep you in a very tight range. Estrogen and progesterone is very different. So when you're in perimenopause, your hormones literally go like this. If I check your hormones today and I check your hormones tomorrow, the levels are going to be totally different. If you're still getting your period, they're going to be very different depending on where you're in your cycle. If you're somebody who has irregular periods, they're going to be very different. If you're somebody who's maybe toward getting close to menopause and not getting your periods very often, those levels are going to be very different. So we actually don't treat hormones, we don't optimize your hormones for perimenopause based on lab results. We use lab results to guide treatment. Let's say you've been on estrogen for 6 months and or 3 months is really when we would check them again and say, I'm not feeling any different. I'm going to check those estrogen levels, and I want to see those levels have been increasing based on where they are. So that's where your lab results become important, not whether or not should I start, but is my treatment effective enough? And just to kind of fine tune, because everybody's a little bit different, and hormone optimization is very personal. And we use the labs to kind of fine tune that for you. But yeah, testosterone is important for women. There's many different ways women can take it. You can do it topically, you can inject it. We have vaginal testosterone. So like I said, it's a personalized protocol, and everyone's body's a little bit different. Everyone's needs and goals are a little bit different. Everyone's medical history is a little bit different. And we take those things all into consideration when talking about hormones.
Especially on the men's side, the range ranges from 250 all the way to 800. So that's considered normal. But I could promise you somebody who's at 700 versus 300, they're completely feeling two different things. Completely two different things. And we do take that into account when we're dosing the testosterone.
So we mentioned a little bit in the beginning about divorce rate, right? And the most divorces happen between the ages of 40 and 60. They call that the gray divorce trend, which basically is divorce after 50. And there's a lot of studies that have come out that say a lot of it is actually secondary to hormones. Why is that time frame? And that is a time frame when men and women's hormones shift significantly. Just like we talk about puberty, right? You can think about it as another change just as significant as puberty in the lives of men and women. And that's why they're thinking that there is higher divorces during that time. And if you think about it, right, having more anxiety, poor sleep, irritability, not seeing that same person, like Corinne said, that you see in the mirror anymore, how that can affect your relationship. Libido is not only a hormonal thing, but it's also a mental thing. And if you're not connecting with that person because you're tired all the time, or you're stressed all the time, or that anxiety that wasn't so polarizing has now kind of taken over your life, it's going to affect your relationship. So we actually have a lot of couples who come in together, or one comes in and then they send the other because they feel so good and they feel much better, and they want their significant other to feel the same. So we do take into account relationships and how your hormones and how you feel are affecting your home life, your relationship with your children. You know, one question I always ask is, do you feel like you're more irritable when it comes to your children? Things that never really bothered you that much, are they now driving you crazy, right? Is the way your husband chewing driving you crazy? And that can all be hormonal. So don't be nervous if you come. We're going to ask you what your libido is like, because it's an important part of physical health, mental health, and it's an important part, something that we like to optimize at NuGen.
So I guess another thing that I want to point on, and it's still relative to what we've been talking about, is that there actually is a real cost to ignoring your hormones. So other than like the individual part of this, right, this actually can affect the workplace. So having hormone optimization has been shown to allow for better personal wellness, improvement in your employment. So problems with hormones that generally are going to come out as decreased motivation, brain fog, inability to complete tasks the same way, irritability in the workplace has been shown to have like lost productivity within an employment. Patients will not show up to work because of their symptoms. There is a relationship strain, and all of this can put an additional cost on the healthcare system if they're using we're going to say the emergency department, because this is where we all have a lot of experience, but coming into the emergency department with these vague symptoms that unfortunately we're not always going to be able to address in the ER. The other thing is, when you're not optimized and you're not at your prime in terms of your brain functioning, it's going to make you very like stagnant in your career, and it's going to give you this reduced quality of life.
So what does a consult at NuGen look like? So your initial consult, we actually allot an hour with you because we truly want to understand who you are as a person, understand your medical history, understand what's worked for you in the past, what hasn't worked for you, what you've tried, and really understand what your short-term goals are, followed by your long-term goals. And we do a thorough history, including family history, medications, all those things. And then it's a back and forth. We also want to make sure what we can offer meets your expectations as well, and set realistic goals, right? Because that's we don't want you to fall out of love with hormones and peptides because the expectations just don't align with what they can do. So that's what we really do. And then we also do an array of blood work, as Danielle alluded to earlier. We check a lot of biomarkers, a lot of blood work, and we make sure all those markers are optimized, just not falling in a regular reference range that the insurance companies tell us that they have to fall within, or the lab, etc. We also have the 3D body composition scale. It's an infrared 3D scale. It takes measurements that you probably don't want to hear about or see, but it does. And then it spits out calculations that tell us your body fat, your lean mass, your visceral fat, your posture even. And we use that to guide us along the way, especially if some of the goals are related to muscles or muscle or losing fat, etc. And then we do that every so often. It could be as regular as 4 to 6 weeks or as long as every quarter, depending on what we're monitoring, what we're checking for. And there's concierge level care involved as well, because you always have access to us if anything were to come up and you needed any assistance in quarterbacking any other part of your health care.
And just back to what Davo said with the 3D body scanner, you're probably thinking, well, what does that have to do with my hormones? It actually has everything to do with your hormones. So hormones like estrogen are incredibly important to protecting your bone health. So when estrogen levels start to drop, that's when your bone protection, you lose it, right? And so that's why we see so many more hip fractures in women after they go through menopause. That's why we see the increase in cardiovascular disease and stroke in women skyrocket after they go through menopause. So estrogen, it's always talked about in terms of my hair, my skin, my nails, hot flashes, and mood, but it's so important behind the scenes too with, we talked about today, like mental health, but also your bone health and your cardiovascular health. So when we do a 3D body scan, it actually gives us your percent bone mass. It tells us, okay, where are you in that? Is when you're losing weight, right? Because many people come to us for weight loss. Are you still maintaining that bone mass? Are you increasing your lean muscle mass? Muscle should be looked at as another organ in terms of your vitality and protecting your body. And when you lose your bone mass, let's say you fall and you break a hip, you could imagine the effect that has on people long-stream, just in terms of their mental health with recovery, the help they need at home, are they able to go to work anymore? So optimizing your hormones are not just going to make you feel good today and tomorrow, they're literally going to save your life in the next 10, 20, 30, 40 years.
So next time you're at work and you feel unproductive, tell your boss it's my hormones.
Go ahead.
I guess the only other thing I wanted to piggyback off of coming in for a consult, the consult, it doesn't end there, right? I think that's something that we really strive is to have a constant connection to our patients. So we want to hear about you. It's very easy for all of us at this stage to go online and we could order pretty much whatever we want, whatever medication we want to be delivered to our home, right? But with that, there's no follow-up, there's no oversight, there's no one-on-one connection with anyone. And it's important even for us and for our education to be able to come back to each other and say, this is what this patient is feeling. Do you think that we could optimize them further? Do we think that we can add something on for them further? Do we think that we need to involve other specialties to help with their longevity plan? So I think that if you're looking for this quick fix where you never have to see a doctor, probably not us, but we're really nice and we're really fun to hang out with. And we really value the education that we constantly try to give to our patients, because it's something that we don't really get an opportunity to do in the emergency department, where if we see you for more than 10 minutes, you're probably circling the drain, right? So it's, we really value education and patients like long-term health.
I guess we'll open up to any questions.
Nope. It's okay.
I think you touched on this on the last Lunch and Learn, but can you talk about cortisol? Because I know that's like such a buzzword. And
So I think in hormones, we kind of focus on your estrogen, progesterone, testosterone, but your thyroid is a hormone, cortisol is a hormone, right? And we check all of those with all of our patients. So when you're thinking about cortisol, people, it's basically a marker of inflammation, but it's a very non-specific marker of inflammation. So it may be elevated and then you're like what do I do with that information? So there's many different websites you can go on and order hundreds of panels of biomarkers and get all this information. But the really most important part of checking your biomarkers is what's next. How does this information affect me? How does this information play into my personal health? And what do I do with that information, right? We live in a time where we can get all these tests done, but what does this mean, and what do I do with that information? So cortisol is an inflammatory marker. So if you're having a stressful time in your life, you've just recently been sick, it could be elevated. You have autoimmune diseases, it could be elevated. You have some kind of cardiovascular disease, it could be elevated. It's very non-specific. So it's a test that needs to be ordered with the context of knowing about you, right? Like your doctor who's talking to you should know your past medical history, what you're taking. It could be elevated based on you reacting to a new supplement that you're taking. So cortisol itself doesn't give you much information, but it's valuable in the context of what you're feeling and what your past medical history looks like.
Yeah, I'm going to say that it is always going to be relative to something else. So an elevated cortisol level should always have the physician, the provider, they should be on the search for what is causing that cortisol level to be elevated. And, Dr. Biggs, stressed a couple points, but it's really meaningless without the context of everything else or other labs or other imaging modalities to truly understand what cortisol even means.
And then we're probably thinking, well, why do I care if it's elevated, right? What does it matter? So chronic inflammation in your body is not good, right? There's a lot of studies that came out that show chronic inflammation is what leads to long-term disease, right? Whether it be Alzheimer's disease, different cancers, all chronic illnesses are secondary to chronic inflammation, whether that be from sugar, right? Diabetes, sugar in your blood, chronic kidney disease, sugar in your kidneys, Alzheimer's, sugar in your brain. All of this increased sugar leads to chronic inflammation, which leads to chronic diseases. So we care about your cortisol being leveled because if your cortisol is elevated, it's showing that there's inflammation in your body somewhere. And we need to figure out where it is and what's causing it so you can once again go back to addressing that root cause and not just treating the symptoms. Another kind of good test that we check a lot in terms of with cortisol is high sensitivity CRP or C-reactive protein. And it's not a marker that's checked very often, but it's a marker of inflammation just like cortisol, but it's more specific to cardiovascular disease. So it helps us tell a person has a higher risk of cardiovascular disease. So let's say you come in and people will come in for weight loss, right? And we do all their biomarker profile and we check in that your high sensitivity CRP, we check your apolipoproteins, which are the molecules that actually carry cholesterol in your body. We check your lipoprotein little a, which is actually your genetic marker for cardiovascular disease. And we take into account all of that with what's going on with you because weight loss, yes, it's an amazing side effect of GLP-1, actually not the most beneficial part of them. So your GLP, your tirzepatide, your semaglutide, your retatrutide, inflammation around your heart and in your blood vessels that cause cardiovascular disease. They decrease insulin resistance, which causes diabetes and chronic inflammatory conditions. There's studies that came out that show they decrease Alzheimer's because they decrease inflammation. Recent studies show that they decrease tumor size because they decrease inflammation. So we have patients who come in to just microdose GLP-1 medications, meaning they don't want to lose weight, they just want the anti-inflammatory benefits of it. So we'll see these inflammatory markers such as cortisol and high sensitivity CRP actually go down with GLP-1s because we're eliminating that inflammation in your body.
There are also other things outside of chronic diseases that can lead to problems with the cortisol or increased stress reactions. And I think that these are noticeable changes that any of us can change on a day-to-day basis without actually needing someone else. It's a good supplement. So having being off in terms of your circadian rhythm or lack of sleep in patients, especially in patients that maybe work more overnight, portion down to patients who, and I don't mean like fat type of diet, it is true, but even patients that undereat, they don't prioritize protein. What else? Lack of relationships with people. and having a more introverted approach and being unable to kind of voice any type of thoughts or problems you might be having all lead to stress, which also lead to increased cortisol levels.
Any other questions? Yeah.
So you're kind of balancing out some of these levels, right? Cortisol, testosterone.
Sure.
How long do you typically see your patients, maintaining this over time? Is it a one and done, or is it you're in there for a year, you're in there for a lifetime? How do you see that?
We definitely don't ever want a one and done, right? A one and done would make us very similar to other medical practices. We want to see patients long term, but in terms of you can touch more on the hormones and things like that.
So that's a great question. On the hormone side, your hormones are going to fluctuate. There's so many variables that go into hormone levels, and as you're getting optimized in different parts of the body, your hormones can fluctuate. So especially on the testosterone side, I check your levels when you first start within 6 weeks to see where you are, and then we make adjustments accordingly. And then once you're stabilized, I see you every 3 months, but I'm speaking to you every month. It's a lot. It's based on how you're feeling and how your symptoms are, but it's an ongoing thing. And we can make adjustments. That doesn't mean we got it wrong. That just means the body's either reacting to it well, or something else is going on, or maybe you have some life stressors the months leading up to that, so we have to account for. So it's an ongoing thing, for sure.
And also it's kind of interesting, we've had men come in and once they lose weight, their testosterone levels actually go up.
So yeah, thank you for bringing that up, Danielle. One of the big killers of tea in men is male obesity. It's male obesity that leads to secondary hypogonadism. It's huge. It's mosh. And if you're just taking tea or doing things to elevate your tea without accounting for mosh, you're behind the eight ball right there. So that's also what we focus on, is a lot of optimizing as a whole and accounting for weight. That's what helps with the body composition scale too. It tells me exactly where you're at, and then we could trend it as you go on the testosterone and the weight loss medications.
Even vitamin D is actually a hormone. People don't think about that, but vitamin D is a really important hormone in your body. And there was a really interesting study that came out that showed that patients who had lower vitamin D levels in their midlife had higher deposition of tau protein in their brain. And more tau protein in your brain is a marker for Alzheimer's disease. So when you get your blood work done, you'll see that your vitamin D level normal is from 20 to 70, but really an optimal level of vitamin D is 60. And patients who had levels of 60 had less tau deposition in their brains and less progression to Alzheimer's disease. And that's an easy supplement, something that you can just take at home. And so these are all little things that we try to tweak in your everyday life to optimize your health. And they may seem small, but they have really big effects downstream.
We're on a mission to optimize Monmouth County, the healthiest county in the country.
But our consults are complimentary. You can book online on our website at nugen-medical.com. We like to get to know you, see what your goals are, see if what our plan fits you, and then we kind of take it from there.
If you guys want to come by for a free body scan, just grab a business card, bring it with you, and we'll hook you up with a body scan. Thank you for having us.
Thank you.